This is the paper Dr. Jen Heyman has in mind and has asked Alexa to look up. It appeared in Archives of Pediatric and Adolescent Medicine in 2005. The issue for the medical team is should they treat Peter based on the positive ELISA test that was obtained by his referring physician. Peter's referring physician wondered the same thing. The issue is basically, should Peter be treated at this point, or should he have further testing? Further testing could involve an invasive test. The paper looked at the same issue. 250 pediatric patients with abdominal pain that was sufficiently troubling to require EGD or esophageal gastroduodenoscopy with biopsy for H. pylori were enrolled in the study. Now, this is a pretty invasive way of making the diagnosis of H. pylori. By invasive, we mean it requires sedation to pass a flexible tube through the patient's mouth, down their esophagus, and into the stomach and first part of the small bowel or duodenum. To prove H. pylori is present, the gastroenterologist biopsies the stomach or duodenal wall. Not only is this uncomfortable, but also involves a risk of bleeding or perforation at the biopsy site. For this reason, the authors were interested in evaluating a group of non-invasive tests for the presence of H. pylori. Thus, prior to the EGD, all patients in this study underwent a series of non-invasive tests, the results of which were not known to the team that did the EGD. The results of the biopsy, the gold standard for the presence of H. pylori, was then used to separate the 250 patients into cases and controls. As you can see, there were 93 cases with positive H. pylori cultures and 157 controls who had negative cultures. Following this classification of patients, the authors then looked at the results of the non-invasive tests. Several tests were evaluated. Jen recalled that the test Peter had, the H. pylori serum ELISA test, did not do a very good job of making the diagnosis of H. pylori. She believes, she recalls, that the fecal antigen test was a good test for this. She's asked Alexa to look the paper up to confirm her ideas.